The box jellyfish. In January 2010, a 10-year-old girl named Rachel Shardlow was pulled from the Calliope River in Queensland, Australia, after something in the water wrapped around her legs and left marks across her skin from her feet to her waist. She lost consciousness before she reached the shore. Medical staff who treated her later said she should not have survived the exposure she had received. She did. Nobody could fully explain why. The box jellyfish carries enough venom in a single tentacle to kill 60 adult humans. Its sting does not cause pain immediately. In the first seconds, it causes a pressure sensation. By the time pain registers, the venom is already moving through the bloodstream toward the heart. Death in untreated cases occurs in as little as 2 minutes, faster than most hospitals can respond once a patient arrives. What makes it more unsettling is its behavior. Unlike most jellyfish, the box jellyfish navigates. It has 24 eyes arranged in clusters across its body. It actively steers around objects. It moves toward light sources. It changes direction when something enters its path. It does not drift, it approaches. Queensland health authorities record dozens of sting incidents every year. Official figures do not include cases where the victim did not reach medical care in time. Those cases are recorded differently. The blue-ringed octopus. In 1967, an Australian soldier named Kirk Watson picked up a small octopus on a beach near Sydney and placed it on his hand to show a companion. Within minutes, he could not speak. Within an hour, he could not breathe without assistance. He survived because a companion performed manual resuscitation for 5 hours until medical help reached them. The blue-ringed octopus is the size of a golf ball. Its bite is painless. Most victims do not know they have been bitten until symptoms begin. It carries tetrodotoxin, the same compound found in pufferfish, with no known antivenom. A single animal carries enough venom to kill 26 adult humans within minutes. The venom works by stopping the nervous system from sending signals to the muscles that control breathing. The victim remains fully conscious throughout. They cannot move, they cannot speak, they can only wait. The rings that give it its name do not appear until the animal feels threatened. In a resting state, it is brown, unremarkable, and entirely invisible against the rocks and sand it rests on. It does not display its warning until the moment before it is too late to matter. It lives in rock pools along coastlines across the Pacific and Indian Oceans, in waters visited by millions of people every year who cannot see it and have no way of knowing it is there. The stonefish. In 2018, a man named Andre Gilden was walking along the waterline on a beach in the Northern Territory of Australia when he felt something press against the sole of his foot. He described it later as feeling like stepping on a sharp rock. He continued walking. By the time he reached his companions 40 meters away, he could not stand. The stonefish is the most venomous fish in the world. It does not swim at humans. It sits on the ocean floor, completely still, covered in a texture that matches surrounding rock and coral with the precision that researchers describe as almost impossible to distinguish, even when examined closely at short range. When stepped on, spines along its back inject venom into whatever is pressing down. The venom causes immediate and total tissue destruction at the entry point. Pain registers within seconds and increases consistently for the following hour, reaching a level that medical literature describes as among the most severe a human nervous system can produce. Untreated cases result in permanent tissue loss. In severe exposures, death occurs within hours. Gilden was treated with antivenom at a regional hospital. He required surgery on his foot. He described the 40 meters he walked after the sting as the longest distance he has ever covered. The stonefish was still on the beach when emergency responders arrived. It had not moved. The cone snail. In 1935, a man named Robert Wolfe picked up a cone-shaped shell on a beach in the Pacific Islands and placed it in his shirt pocket. Within 20 minutes, he was unable to move one arm. Within an hour, he was dead. The cone snail hunts using a harpoon-like tooth that can extend in any direction from any part of its shell, including the end most people hold when picking it up. The tooth moves faster than the human eye can track. The venom it delivers, called conotoxin, has no antivenom. There is no treatment for a severe cone snail envenomation beyond managing symptoms and waiting. Medical literature documents that a significant cone snail sting produces paralysis that moves upward through the body over a period of hours. Vision fails. Speech fails. Breathing becomes voluntary, then impossible. The process is documented in clinical detail because patients remain conscious throughout and can describe what is happening to them. Several accounts exist from victims who survived partial envenomations and recorded their experiences in detail. The cone snail does not pursue prey. It sits on the ocean floor and waits. It waits with a patience that requires no effort because it has no concept of time passing. When something comes close enough, it acts. When nothing does, it continues waiting. It has been waiting longer than humans have existed. It will continue after. The saltwater crocodile. In December 1945, Japanese soldiers retreating through mangrove swamps on Ramri Island in Burma were surrounded by British forces and forced to move through several kilometers of coastal swamp at night. Of the approximately 1,000 soldiers who entered the swamp, fewer than 500 emerged by morning. The saltwater crocodile is the largest living reptile on Earth. It reaches lengths of 6 meters, it weighs up to 1,000 kilograms. It can hold its breath underwater for over an hour and wait in complete stillness for periods that outlast the patience of anything watching for it. Its bite force is the strongest recorded of any living animal. It does not kill by venom or by crushing. It grips, pulls underwater, and rotates until whatever it is holding separates. It does not need to see its prey. It detects pressure changes in water from significant distances through sensory organs along its jaw. When something enters the water nearby, it knows. The British forces stationed outside the Ramree swamp reported hearing sounds throughout the night that they documented in official accounts without describing further. A naturalist named Bruce Wright was present and later wrote that the screaming of the men was punctuated by sounds he had never heard before and did not hear again. The saltwater crocodile has not changed significantly in 200 million years. It did not need to. The Irukandji jellyfish. In 1952, a doctor named Hugo Flecker documented a series of patients along the Queensland coast presenting with identical symptoms that no existing medical classification covered. Severe lower back pain, muscle cramping across the entire body, a feeling described consistently by patients as a sense of complete and total impending death, not as a symptom of pain but as a distinct psychological certainty that they were about to die. He named the condition Irukandji syndrome. He spent years trying to identify the cause. The Irukandji jellyfish is 1 centimeter in diameter. It is nearly transparent. It is invisible in open water to any observer who is not specifically looking for it, and largely invisible even then. Its sting is not immediately painful. Most victims do not notice it. Symptoms begin 20 to 30 minutes later. The psychological component, the overwhelming certainty of death, is caused by massive catecholamine release triggered by the venom. The heart rate increases to dangerous levels. Blood pressure spikes. Several deaths have been attributed to cardiac failure caused directly by this response. Flecker eventually identified the creature in 1964 by stinging himself deliberately to confirm his theory. He survived. The Irukandji is found throughout Australian waters. Recent research has documented it expanding its range significantly as ocean temperatures change. It is now being found in waters where it was not present before, in coastlines that had no reason to look for something 1 centimeter wide and nearly invisible. It was there before anyone thought to check. It is still arriving in places that do not know to look yet.